Today, the National Press Club, the Minister for Health, Ageing and the National Disability Insurance Scheme, Mark Butler. He's expected to outline how the government plans to slow growth of the NDIS while maintaining support for those who need it. Mark Butler with today's National Press Club address.
Hello and welcome to the National Press Club and today's Westpac address. My name is Tom Connell. I'm the President here and also an anchor at Sky News Australia. Our guest today is Mark Butler, Minister for Health and Ageing, Minister for Disability and the NDIS as well. It's a scheme that's been life-changing for many of those who access it, to get care that it's enabled them to lead more fulfilled lives and just get the sort of care and support many would argue every human deserves. The sustainability of the scheme, though, has increasingly dominated headlines. The cost is growing at 10%. It was at 22%, so it is an improvement. The number of people accessing it is essentially double than was planned initially, and prices charged by providers have often attracted a so-called NDIS tax. Fixing it will not be easy. Those accessing the scheme are worried about the care they'll get for them and their loved ones. Premiers, already this morning, worried about the cost they could be up for. Perhaps the most obvious example, though, of why this is a hard task is the fact the Minister was here at the National Press Club in August outlining reform plans, and 8 months later he's back again. He is, of course, welcome any time, though. If he can land the change that keeps everyone happy and the scheme sustainable, perhaps the article today saying he could be a leadership contender will prove to be prescient. I remind our members the club will have a podcast of this address on our website later today, and I thank Grace and Lewis, our Auslan interpreters, as well. Ladies and gentlemen, please join with me to welcome Mark Butler.
Well, thank you, Tom, and thank you to the Press Club again for having me. I want to begin, of course, by acknowledging the traditional owners of these lands, the Ngunnawal people, and pay my respects to their elders, past and present, and to any First Nations people who are here with us today. I also want to acknowledge my colleagues, as Morris did earlier, Jenny McAllister, the Minister for Disability and the NDIS, Sam Ray, the Minister for Aged Care and Seniors, and of course the Finance Minister, Katie Gallagher, among some other colleagues who have joined us today. Their leadership and the important work that's underway in those respective portfolios is strengthening care and access for so many Australians. A little over 80 years ago, both of my grandfathers were coming home from serving with Australian forces in North Africa, the Middle East and then New Guinea. And like so many returning servicemen and women, they had been away from Australia for several years in their 20s, and they were impatient to get back on with civilian life. They found jobs, both of them as newspapermen, as it happens. They found partners and they found homes. And they had kids. They had lots and lots of kids, including my mum and my dad. And now those babies are turning 80. The critical age for measuring demand for aged care, and they're doing it in unprecedented numbers. In the 4 years from 2012, the net increase in Australians aged 80 and older was just 70,000 across 4 years. Over the coming 4 years, that number will be more than 300,000, 4 times the growth we saw a little more than a decade ago. That's why I've said a number of times we need to open a new aged care facility in Australia every 3 days on average for the next 20 years. And right now, we're not doing that, not by a long shot. There's a lot of talk right now about intergenerational equity, and quite rightly, that talk focuses mainly on a lack of opportunity for young Australians, particularly in housing. Young Australians aren't just our cherished kids, though they are. They're also the country's future, and they require us to invest in their opportunities to build contributing lives in this amazing nation. But there's another profound generational challenge in Australia which sits at the other end of the age spectrum, and that's providing dignity and care to that fast-growing cohort of Australians aged over 80. Just as young Australians need us to invest in their opportunity, those older Australians who built the country that we are so privileged to live in today need us also to invest in their dignity and their care at the end of their long lives. So this budget will invest $3 billion in delivering more beds, more packages and better care for older Australians. In our first term, Annika Wells did excellent work, passing generational reform in a new Aged Care Act with the support of the opposition. And Minister Ray is now busy implementing these important reforms. But more work is needed, especially to get those new aged care homes built. We recently received an independent review of aged care accommodation funding, which was designed to help us get construction moving. In this budget, the government will deliver a first response to that independent advice, which is focused on delivering more aged care beds for supported residents, those residents who have limited financial means. This builds on the changes we delivered in our first term that incentivise construction of beds for residents who do have the financial means to contribute to the cost of their accommodation. The review also contains recommendations about capital assistance to aged care providers who are planning to build new homes, and Minister Ray is going to lead discussions with the sector about those recommendations for future consideration. But the investments I announced today will support the construction of an additional 5,000 aged care beds each year. We also all know that older Australians with high-level dementia need targeted supports, so we'll also invest over $200 million to deliver 20 additional specialist dementia care units and expand the hospital to aged care dementia support program, which is already helping older people successfully transition from hospital into residential aged care. We've also been closely monitoring the rollout of the new Support at Home program that started last year. This program is undeniably delivering improvements to the system. It's delivering more packages, better quality packages, and it's reducing wait times. But we've heard community concerns on some aspects of the program, particularly around showering. So in response, in this budget, we'll invest around $1 billion to change the treatment of showering, continence management and dressing through the Support at Home program, making those services free of charge alongside clinical care. Dignity in older age through a world-class aged care system is the least that our parents and grandparents deserve. We want to deliver that with our aged care package, but it will require serious investment and honesty about where taxpayer dollars are best spent. Right now, we subsidise private health cover for Australians over 65 at a higher rate than other Australians. In the election environment of 2004, with government coffers frankly reaping the benefits of the China boom, John Howard increased the private health insurance rebate, but only for Australians over 65. In 2026, that's a policy that's harder to defend. It means two households on the same income receive different levels of government support based only on their age. And that's simply not fair between generations. And it's simply not the best way to spend precious taxpayer dollars on behalf of older Australians when we need to do so much heavy lifting in aged care. So this budget will return the rebate for older Australians back to the level paid for everyone else and divert that money back into aged care to fund that package. I understand this won't be a welcome decision for many, but it is the right thing to do to re-establish intergenerational equity in the rebate system and also to free up funding that we need to provide more dignity and more care to older Australians. Of course, equity and dignity were right at the heart of the long battle for disability rights and ultimately the NDIS. The NDIS is one of Australia's great human rights achievements. It's a great Labor reform and we want every Australian to be proud of it. Within just 13 years, the NDIS has gone from a dream of generations of activists to a cherished national institution. It's changed lives and it's changed our country, both for the better. And let me be clear, the NDIS will continue to grow every single year. But for the sake of the people the NDIS was created for, we have to make sure it's sustainable now and for future generations. Right now, the NDIS costs too much and it's growing too fast, put alongside any comparable government program. And unless we take action to make it sustainable, it simply will not be there in the future for the Australians who need it most. We can't afford for the NDIS to continue growing at its present rate, but far more importantly, we can't afford for the NDIS to fail. Part of the challenge that we face is that the NDIS has become a soft target for shonks and rorters, as well as the worst elements of organised crime. I want to be very clear about this. When we talk about fraud in the NDIS, we're not talking about people with disability. We're not talking about families who've been put on a plan and offered support. They're not doing anything wrong. The fraud in the NDIS is being perpetrated by lowlifes who are scamming both the taxpayer, but more importantly, people with a disability. The scale and the chaotic nature of the NDIS market is also distorting other parts of the care economy and too often not providing high quality care for participants themselves. And all of this, we know, is hitting the scheme's community support and its social licence. Last year, I referenced independent research that showed declining community confidence in the scheme. And updated research by Talbot Mills reveals that that trend is simply getting worse. While 7 in 10 Australians still agree that the NDIS plays a vital role for people with a disability, 7 in 10 also think it's gotten too large and struggles with dodgy providers. Worse still, more than 6 in 10 Australians actually think it's broken. Now, I know that this dramatic shift in community sentiment is just as troubling for disability advocates and NDIS participants as it is to the government. The starting point for the government is this. We take pride in the fact that Labor built the NDIS, and we're taking responsibility for securing its future. That's why in every budget we've worked to put the NDIS on a more sustainable footing. In 2022, we inherited growth of 22% a year. In 2023, we brought National Cabinet together to agree on how to bring that growth rate back down to 8% by this year. And earlier this year again, we brought National Cabinet together and agreed to a lower target of 5 to 6% growth or lower. I want to acknowledge Bill Shorten and Amanda Rishworth for their hard work in driving NDIS reforms during our first term in government, and Jenny McAllister, who has worked tirelessly over the last year to deliver a more sustainable scheme and to tackle fraud. While our efforts are bearing fruit, much more needs to be done to protect the NDIS and the people who rely upon it. And the fundamental barrier that we continue to face is the design of the scheme itself. The Fraud Fusion Task Force that we established shortly after coming to government has identified 8 recurring design failures in long-standing government programs that make them susceptible to fraud. The NDIS has all 8. It also identified 7 fundamental building blocks for high-integrity programs. The NDIS has none of them. These structural flaws mean that measures that we have introduced to control spending are simply not working as we intended. And as I said last year, even 8% growth is simply not sustainable indefinitely. At that rate, by the end of the decade, spending on the NDIS would cost more than Medicare and the PBS combined, the backbones of a universal healthcare system. And that's why the National Cabinet earlier this year agreed to work to get that spending growth down to 5 to 6% or lower. But our efforts even to get to 8% are still hitting hurdles. The scheme actuary has recently advised government that spending has blown out by $13 billion over the next 4 years. Left unchecked, this blowout would mean that we will not achieve the 8% target until the end of the decade instead of this year. Decisions in the Federal Court and the Administrative Review Tribunal have restricted the agency's ability to implement scheme changes that were designed to ensure that the scheme serves and supports those it was built for. Legislative uncertainty has also raised serious questions over the agency's ability to implement a range of scheme changes designed to improve quality and control spending, such as the new framework planning system that was agreed by all governments in principle some time ago. This new planning system will deliver more certain and equitable outcomes for participants, but as the NDIS Reform Advisory Committee said very recently, more time is needed to deal with those legislative uncertainties and to remove the risk of other unintended consequences. So the new framework planning system will now roll out from 1 April next year instead of July this year. Most significantly in spending blowout terms though, the agency has not been able to reduce the number of plans undergoing an unscheduled reassessment. 1 in 5 plans are currently subject to one of these reassessments every year, often at the request of plan managers who can stand to gain, not the participants themselves. And the average result of these reassessments is a 20% increase in plan value, a huge driver of spending growth. The agency committed to getting those reassessments down from 20% a year to 15%, but hasn't been able to deliver on that. These cost blowouts simply cannot continue. So when Parliament returns, I'll introduce legislation to get a grip on these drivers of scheme and plan inflation for good. This is simply good management, long overdue. Other drivers of scheme inflation that have got out of control are also going to be addressed by this bill. The runaway budget for social and community participation is one such area. Now, the NDIS was built on the promise of inclusion. It was meant to act as a framework that opened society up for people with a disability and allowed genuine community participation. But the current way the NDIS approaches social and community participation means that programs which once provided real opportunities for connection have been allowed to wither away. Where programs do exist, supported often by volunteers, they're often overwhelmed by NDIS providers who drop their participants off without any notice. And while many support workers provide valuable supports, too many participants tell us their support workers are spending more time on their phones than engaging with them and providing support. We've received reports of participants falling out of their wheelchairs while a support worker is scrolling on their phone. There's no connection there, there's no participation, there's no inclusion. This is not only a failure to show respect and dignity, it's also a safety issue. This approach hasn't just led to the decline of genuine community support, it's also become extraordinarily expensive. 5 years ago, just this stream of support cost $4 billion per year. This year, it costs $12 billion, triple the spending in just 5 years. Today, that one stream of NDIS is costing about the same as what we spend in net terms on the entire pharmaceutical benefit scheme. And if left unchecked, the spending is projected to skyrocket to around $20 billion just for social and community participation by the end of the decade. This cannot continue on this current course. So we will reset the total cost of social and community participation back to where it was last year and prevent any runaway growth. Now, I want to be honest with people. This will have a material impact on participant plans. In terms of the average actual spend by participants, this will take people back to where they were in 2023. The average spend on this activity today is about $31,000 per participant, up from just $14,000 5 years ago. Over the next 2 years, our changes will bring that figure down to about $26,000 per participant, back to where it was in 2023. I want to say, without those changes, that figure will have been more like $33,000. Those figures reflect the total spending by participants. The reduction in their budgets will appear even larger than that due to differences in utilisation. We're also going to establish a $200 million fund, the Inclusive Communities Fund, to rebuild capability among community organisations so people have new options, meaningful options, to genuinely participate in their local community. This fund is going to be open to mainstream as well as disability organisations, with details to be settled in consultation with the disability community. We're also going to move quickly to improve the quality and reduce the cost of the huge number of third-party intermediaries in the scheme, those third parties who manage the majority of NDIS plans and claims. Now, many of these people provide valuable support to participants, but others have no qualifications or background in disability services and seem more interested too often in clipping the ticket. We will reduce spending in this area by 30%. Market models are designed to create competition, but too often in the NDIS, we see that competition play out with third parties cutting costs and cutting corners to get as many plans on the books as possible, rather than trying to win clients based on the quality of their service. Instead of this contest continuing, our government will identify a short list of accountable, quality providers which people can then choose from. Making the NDIS sustainable is also about returning the scheme to its original true purpose. The NDIS, remember, was established to support people with significant and permanent disability, but its scope has expanded to cover many Australians with less significant support needs. The Thriving Kids reform that I announced right here last year marked the beginning of our determination to reset the scheme to its original intent and keep the scheme strong for those it was built for. We now intend to build on that foundation. The bill that I intend to introduce in the budget sittings of Parliament will allow us to introduce standardised, evidence-based assessments of a person's functional capacity to determine access to the scheme. In line with the scheme's original intent, access will be based upon a significant reduction in a person's functional capacity that impacts their day-to-day living. It will also remove the use of the lists that currently decide a participant's eligibility based on diagnosis alone. These so-called access lists were put in place to get the scheme up and running, but they were always supposed to make way for an objective assessment tool. Instead, the diagnosis gateway has funneled people onto a scheme that was never designed for them. Now, that's not their fault. They've been told this is the only program available, or that this is the help that their child needs. It's our responsibility as governments to make sure that in the future these Australians are pointed in the right direction. Now, this is a big change to the scheme, the details of which will be worked through carefully over coming months with a technical advisory group, members of the disability community, and obviously state and territory governments. The NDIS was originally intended and expected to support around 410,000 people with a disability. Today, there's more than 760,000 people on the scheme. While new eligibility rules obviously need to be worked through carefully, our initial modelling will see the number of people on the scheme reduced to around 600,000 by the end of the decade, instead of growing to well over 900,000 on current projections. This is still substantially higher than the Productivity Commission projection of 550,000 by 2030. As we've done with Thriving Kids, we'll also work on establishing programs with states and territories, which the NDIS review back in 2023 described as foundational supports, to give quality local supports to people who are not given access to the NDIS. This work already has $6 billion allocated to it by earlier decisions of the National Cabinet. Like Thriving Kids, this will see us rebuild systems that used to be there for people with less significant support needs, systems that were unfortunately too often dismantled, leaving the NDIS as the only port in a storm for so many Australians. Under the NDIS market that was set up by the Coalition, you need more ID to get into a licensed club than you do to be an NDIS provider, and that's going to change. Not every provider needs to be fully registered. We don't need to monitor retail purchases from a chemist the same way we monitor close personal care of vulnerable people. But we will expand categories of mandatory registration to include those high-risk activities, personal care, daily living supports, and supports provided in closed settings. This builds on existing mandatory registration requirements and the government's earlier decision to introduce mandatory registration for supported independent living, or SIL, as well as platform providers from the 1st of July this year. We also need to tackle how the payments are claimed and managed. Currently, the NDIA, the agency, has no visibility of evidence for 90% of claims that are made by plan managers or by providers directly. It's around 600,000 claims every day without any supporting evidence. And the standard of invoices that are submitted can vary wildly. Worse still though, this lack of integrity in the system has opened the door to the worst parts of organised crime. The Australian Criminal Intelligence Commission recently told a review into NDIS integrity that criminals are paying cash kickbacks to participants and their families, and sometimes resorting to intimidation and threats of violence towards vulnerable people. The Commission said large cash withdrawals, asset purchases, and fraudulent financial transactions are common, including efforts to obscure the origin of NDIS funds. This underlines the serious need for action to tackle the lack of integrity in the payment system itself. So enrolling providers in a digital payment system will mean that the agency will be able to see evidence from every single provider and ensure that they are paid directly. Again, this isn't about scheme design or scheme reform, it's simply good management. Now, these are all hard decisions, but they're unavoidable and they're urgent. And I'll be seeking passage of these immediate spending controls in the budget session of Parliament. We'll be working to get the support for that good management from the opposition and, of course, from states and territories who now have much greater funding responsibility for the scheme after this year's National Cabinet decision. The deeper reform, rebuilding how the NDIS will operate into the future, will be done through genuine and respectful work with the states and, importantly, with the community itself over coming months. While we're determined to put in place strong management systems immediately, reforms that go to the nature of the scheme and the types of supports that it delivers should always be framed by the commitment, nothing about us without us. Beyond the eligibility rules that I just discussed, that engagement with the community and states will include the design of the Inclusive Communities Fund, commissioning of supported independent living, plan management and support coordination rather than simply relying on a market that's frankly not working, and differentiated pricing between registered and unregistered providers, ongoing implementation of new framework planning and much more. This is the government's plan to secure the future of the NDIS, a plan that rests on 4 pillars: fighting fraud and stopping rorts, slowing these rapid cost increases, clearer eligibility requirements, and so importantly, delivering high-quality supports and services for participants. Because Australians expect the NDIS to support people with a disability and their families and to continue to transform their lives in the way we've seen happen over the past 13 years, not for it to be an ATM for shonks and grifters, fraudsters and crooks. Under this plan, the NDIS will grow every year. But instead of costing more than $70 billion in 2030, taxpayers will spend around $55 billion. Over the forward estimates, spending will grow around an average of 2% every year as we reset many of its design features before returning to 5% growth over the medium term from 2030. It will still be the largest social program in Australia outside the age pension, and the centrepiece of the most comprehensive suite of supports for people with a disability you'll find anywhere on the planet. The NDIS was established as a partnership between the Commonwealth, states and territories, and for the scheme to succeed in the long term, that partnership must succeed. States and the Commonwealth will need to work together to remake the NDIS for the future, and I extend a hand of genuine partnership and goodwill, and I know the community expects that states will do the same. The NDIS will obviously be accounted for in the budget, but this is bigger than the budget. The NDIS is a statement of our national values. It's a measure of our national character. It's more than a source of support for people with disability, it's a source of pride. But every story about a dodgy provider rorting the system eats away at that. Every example of taxpayer money wasted on fraud erodes that trust. It's why these reforms are about much more than budget savings. This is about saving the NDIS itself. Because if we act now, we can safeguard and strengthen it so that it serves Australians it was created for, so that it upholds its purpose of providing choice and control, dignity and opportunity to Australians with a permanent and significant disability. And then we can make sure that, like Medicare, the NDIS is still changing lives 3 decades from now. But if we wait, if we hang back, if we imagine that hard choices can wait for easier times, then the decision will simply be taken out of our hands. The social licence will be lost, and the NDIS will not be able to deliver what Australians with disability deserve. Our government cannot and will not accept that. This is the right thing to do, and it's the right time to do it. For the sake of people who need the NDIS today, and so future generations can count on its promise for decades to come. Thank you very much.
Thank you, Minister. A lot there. I might start with a broad question, because you've been speaking about a lot of these issues and even sort of the solutions for quite a while as well. Is it fair to say that you were hoping you could convince a lot of people, whether it be providers, people doing diagnoses and so on, to do the right thing, and now it's just time to make them do the right thing?
Well, I mean, I've tried to be honest about what I think are some genuine flaws in the design of this scheme. This scheme was designed with the very best of intentions and with so much enormous buy-in from the community, from states and territories, and obviously a Labor government and two Labor Prime Ministers in Kevin and Julia who wanted this to be a serious legacy of their time in government. But I think as time has gone on, we've found that some of those design features aren't working well. They're not working well for government, but more importantly, they're not working well for people with a disability. Now, I've tried to take a sequenced approach to this. I came here, as you said, Tom, in August last year to outline our plans for children under the age of 9, thriving kids reforms that are in the process of now starting to be rolled out. And I said back then that I thought the 8% target that National Cabinet had agreed needed to be built upon with a lower, more sustainable target, and essentially said that was something that National Cabinet had to discuss, and they did that earlier this year. So from that decision of National Cabinet a couple of months ago, I've taken it as effectively a tasking from National Cabinet to work out a plan to deliver that growth target and to achieve what every government wants, Liberal, Labor, state or federal, and that is to secure the NDIS for the future, for the long-term future. So, I mean, yes, this has been a process that started with the NDIS review that we commissioned when we came to government by Bruce Bonner, Haiti and Lisa Paul, a review accepted by all governments back in 2023, and it will take some time to work through. But frankly, some of the well-intentioned measures that were put in place by us in our first term that we thought would start to control spending just aren't gripping. They're not gripping because of some of these system flaws, some of these uncertainties in the legislation that we need to clear up, and frankly some real problems in a chaotic free-for-all market that was allowed to build up over the last 10 years that's not spending taxpayer money well and not serving the interests of participants.
Got basically the whole press gallery here, so I'll go straight to them. Natasha Chrysanthus, first of all, from the SMH&H.
Thank you. So NDIS will come in at about $50 billion this year. You've just signposted you only want it to be $55 billion in 5 years' time. That's growing at about $1 billion a year from growing at about $5 billion a year at this point. It suggests these changes will need to be made very quickly. So when will you expect the eligibility changes in these coming laws to come into effect? Will that see a kind of a mass progression of people outside the scheme? And then how will you cut back on that $12 billion figure for community and social participation? Will that also involve overnight changes to people's plans and restricting what people spend money on?
This is what people were saying and no one asking one question, wasn't it? Yeah. What I've tried to set out is a two-stage process. The first is we need urgent financial controls put into this scheme, and that is why I'll be introducing legislation as soon as budget resumes in Budget Week and seeking the passage of that legislation during that session. That will allow us to deal with some of the growth in spending that we've had reported to us from the actuary, the $13 billion blowout that I referred to, and also some of the other areas of uncontrolled growth that we're continuing to see. This is just about good management. So we want to see that passed by the 30th of June, and many of those measures will start to take effect immediately. For example, cutting down on unscheduled reassessments, which is a big driver of growth. In terms of eligibility, that is something obviously we need to work through much more carefully with the community and with states. We want to have that work supported by a technical advisory group, and that will happen over coming months. I'd like to see that work done by the end of this calendar year so that we can then start putting in place new eligibility rules that people all understand and building that assessment tool. I'd see that starting on the 1st of January 2028. For new entrants or new applicants for the scheme, and then would be the subject of ongoing reassessment for existing participants over a period of time as their plans came up for renewal.
Next question, Emma Myers from Powered Media.
Hi. So in the current cost of living crisis, why have you decided to cut the supports of NDIS participants? Will there be additional supports to help us cover the cost of living?
Well, thank you for those questions. We've worked very carefully to identify where we think we can control spending growth and areas where we think we need to essentially preserve existing support. So those areas of support that are essential for daily living, accommodation supports, personal care, transport, hygiene, continence, medication management or all the rest will not be subject to any of the controls that I have talked about. The areas where we think there is spending growth that we need to constrain are things like unscheduled plan reassessments. There will still be the capacity for those reassessments, but they should only happen in exceptional circumstances where there has been a significant change in circumstance for the participant. Social and community participation, I understand, will have a material impact on existing participants. Getting that spending back to where it was a few years ago is going to mean a reduction in the number of hours that participants have to spend on that. And now for people who are still or supported independent living participants, they'll be able to reallocate some of their activities of daily living budgets to fill that gap. But for others, that will have an impact, and I understand that. And we haven't done that lightly, but an area that has tripled in the last 5 years alone and is projected to grow to $20 billion in itself is not something we think we can continue to sustain. But it's not just about the spending, it's the quality of those supports, which is why alongside that we are building this Inclusive Communities Fund, because we want to rebuild the capability of community organisations, whether they're traditional disability organisations or sporting clubs, arts groups and so on and so forth, to host NDIS participants in them. That was the original vision of the social and community participation element of the NDIS.
Katina Curtis from the West Australian.
Thanks, Minister. Wow, there was a lot in that. 2% growth over the next 4 years. That's below where inflation is at the moment. It's about half of inflation and we're only expected to get higher. Isn't this a cut in real terms?
Yeah, I've tried to be honest about this with people. It was a deliberate decision of government to pull this out of budget and not just announce this in budget night, which you all know is a pretty mad week. There's a lot happening because we want to have an honest conversation with people about this, to reset this scheme, both those areas where spending is growing out of control and to return the scheme to its original intent in terms of the scope of its coverage. There is going to be a period of very low growth. Resetting the scheme means that over that forward estimates, on average, growth will be across those 4 years just 2% a year. That's as we reset it to its original intent. Now, once that job is done at the end of the decade, you'll see it return to more like 5%, which I identified last year as the proper rate of growth for a social program which is mature. That's essentially population growth plus inflation. But, you know, I wanted to be honest with people. I wanted to allow a bit of conversation about this package, this plan, separate from the budget week, which will take place in 2 or 3 weeks, so that people can chew over this and really understand it. I also want to be honest about the fact that there will be some areas where there is a material impact on participants, particularly in that area of social and community participation. It's a hard decision, but it's the responsible, the right decision for us to take as a government, because we cannot see this scheme continue on its current path. It will be unsustainable from a taxpayer point of view, but much more importantly, its community support, its social licence is slipping away, and we can't let that continue to happen.
You spoke about an honest conversation though in terms of real dollars and number of people. In the short term, it's not growing, it's shrinking. That's the honest take, isn't it?
Well, it will continue to grow. Now you can match this against inflation, which is jumping around a bit, but if it, Katina's right, if inflation is significantly higher, but we need to recognise this 4-year period as a reset period. It really is going to change the nature of the scheme in some areas of expenditure and also in terms of the coverage. So the number of participants that is covered I've tried to be honest, will change over the course of the next 4 years. So that will have an impact on the total spend of the NDIS. But once that reset is done, and it's absolutely the right reset, I'm convinced of that, then of course the scheme will continue to grow in an appropriate way like other social programs. That 5% growth is what you will see in areas like Medicare and childcare and such like, and that's where the NDIS should be as well.
Sarah Ison from The Australian.
Sarah Ison, thank you for your speech. Can we take from your speech that you'll be looking to expand that effort of diverting kids under 9 with autism? You'll expand it out to people over that age group and more adults with autism and so on. And if I can just ask, the PM says he doesn't see the NDIS as a fiscal position. Jim Chalmers says it's central to the savings of this budget. Which do you agree with?
I always agree with my Prime Minister and my Treasurer, so I agree with both of them.
It's a fiscal position?
Long enough to know that's a very wise course of action, and with my Finance Minister as well. But let me say, because I've seen some coverage about mental health potentially being an area that we seek to move away from the NDIS. And there's just no basis for these reports. What I tried to say in my speech is I want to get away from the diagnosis list, the diagnosis gateway. We need to return the scheme back to a question of functional capacity. That's what it was built on, the idea of people with significantly reduced functional capacity that impacts their day-to-day living needs. So there's no particular area of diagnosis that will be treated differently to others. What it will mean, though, is that Australians with lower support needs or higher functional capacity, depending on your perspective, will be moved out of the scheme.
So adults with autism would fall into that, sure.
Well, depending on their support needs.
Depending
on their support needs. But adults with other disabilities or other diagnoses will be assessed according to their functional needs, not according to the label that a particular doctor has given them. On the other question, I just want to be really clear about this. Obviously, the NDIS is important for the budget because it is such a large social program now. But I want to be really clear. This is exactly the package I would have taken to the Expenditure Review Committee, no matter what the budget context. No matter what the budget context, because this is the right package for the NDIS and it's the right package for participants.
Thank you.
Mark Riley from the 7 Network.
Thank you, Morris. Minister Mark Riley from 7. I just want a bit of overlap with Sarah's question, but just want to investigate the reduction in participants from 760,000 to 600. I know it's not pure maths, but who are these 160,000 people? Are they primarily kids with autism? Are kids with autism on the NDIS now going to be reassessed, and could they be diverted away from the scheme towards Thriving Kids, or is it only for future applicants who might be diverted that way?
Well, Thriving Kids was built for under 9s and that work is underway. They've been the subject of agreements with states and territories. We've had great discussion about the design of that model. So that's sort of off and running, if you like, for under 9-year-olds. For people over 9, what I'm announcing today is that their functional capacity will determine whether they stay on the scheme or whether they enter the scheme in the first place. And if they have lower support needs, they won't be on the scheme in the long term, and they will return to the sorts of support systems that were in place before the NDIS. And frankly, were always intended to continue to support those people. Now, just because of the numbers of people with autism on the NDIS, the biggest area or the biggest cohort on the NDIS, that will impact adults and older children with autism if they have those lower support needs, if they're objectively assessed as having lower support needs. But it equally will impact people with other diagnoses or other disabilities. So it's not about singling any particular area out. The important thing, though, is that we rebuild those other support systems. They were always in place. The NDIS review that Bruce Bonahady and Lisa Paul recommended, we rebuild them. All state governments agreed with us about that in 2023. We've allocated $10 billion in total for that work. $4 billion has been essentially allocated to Thriving Kids. $6 billion is still there, allocated by all governments to start to rebuild those local community supports, whether it's for older children or whether it's for adults with low support needs. Obviously, we can't leave people between two stools. The rewrite of eligibility systems has to happen in tandem with the rebuild of those local community support systems.
That's the risk of breaking the rules and asking
everyone else.
Question. Yeah, I know.
In for a penny, in for a pound.
You know me, I'm such a follower, Minister, but have you just said that each person under the NDIS will be reassessed for their suitability to the scheme? If they're not suitable, they may be shifted off?
Yes, I said that in my speech, and frankly, reassessment is a part of the NDIS currently. So yes, over a period of time, we will, over the coming months, we will work on an objective assessment tool that's been clearly the expectation of the NDIS. It's just work that hasn't happened. With the support of a technical advisor group, with the participation of the community and with states. And I would expect that to be in place for 2028. Now, that will govern entry to the scheme, in my expectation, from the 1st of January 2028, and will be the tool that governs reassessment of people, which happens at the end of their plans.
Thank you.
Phil Curry from the AFR.
Thanks, Minister. Thanks, Tom. Sorry? Don't worry. Okay. Just back to the Thriving Kids thing and the current negotiation with the states, which began back in 2023. By my calculation, you've now given them $25 billion extra in hospital funding between now and 2030 and an extra $10.5 billion in GST top-ups. How much, or if any of that money, won't be handed over if the states don't sign up? I know you're doing it on a bilateral basis, but for example, Queensland, which is the most recalcitrant at the moment, are you prepared to say to David Crisafulli, you're not getting that dough if you don't sign on?
Well, I think everyone, let's leave aside the fact that there's always politics played here. You've been around long enough, Phil, to know that state and federal governments...
You've wafted a lot of money
after. There's a bit of political posturing here. But there have been moments over the last 3 years where state governments could have said to the Commonwealth, you do NDIS, you do foundational supports, and we'll look after the hospital system. We don't need any extra money from you. They didn't do that. They said, we need extra hospital funding and we'll do some heavy lifting with you on the NDIS. We'll sign on to foundational supports. We'll deliver the Thriving Kids program. Now, there was an opportunity for Queensland or any other state to say they didn't want to do the package deal that was done a few months ago, but they didn't take that opportunity. They all signed on to what is a package deal. It wasn't a buffet that they can pick and choose from. I like this bit. I love the $25 billion extra funding for hospitals. This was a package deal. And of course, we expect states and territories to implement it, but much more importantly, the community expects them to deliver it. I think community members, people out there, just want government to get on with it. Build the Thriving Kids program, get the NDIS back on track, make sure there's enough funding in our hospitals for them to operate properly. This has gone on for 2.5 years. We can't have more political arm wrestling between jurisdictions. We've done the deal. Governments now have to abide by the deal and get on with the hard work of building better supports for their communities.
And if they don't, will money be withheld?
Well, I mean, I take this. I've seen a bit of coverage from one jurisdiction. I've not got any indication from the Queensland government. I don't think the Queensland Premier has said that Queensland wants to withdraw from the National Cabinet deal that would see them receive, I think, about $5.7 billion in additional hospital funding. I take this as the usual sort of arm wrestling that happens between governments in these challenging areas. Budgets are growing. We know that in hospitals, in disabilities, in aged care. there's a lot of pressure on all levels of government. That's why we worked so hard since 2023 to come to a sensible deal that divided responsibilities appropriately, but shared responsibility for making sure that people out there got the best possible support.
Charles Croucher from the Nine Network.
Thank you, Tom. Thank you, Minister. You mentioned scammers and shonks, but also organised crime being involved in some of the rip-offs that are going on. Serious operators in the criminal side. Is this blended fraud fusion task force that currently looks into the scam and the fraud enough, or does this need to be placed solely in the hands of law enforcement to save money, save the system, and ultimately save the reputation of the scheme?
Well, I think we haven't been able to just flick a switch and move from a completely unregulated market that we inherited 4 years ago into something where we have a line of sight over everything and can send the cops in if something's not going right. But we've been building very steadily. We now assess the same number of claims every single day that were assessed in an entire year under the former government. We've got this task force operating. There are more prosecutions. There are more people being banned. But as I've said today, we need to build out our registration system. So we're confident that particularly providers of really close services are registered and comply with a whole range of quality indicators. And the measures I announced today mean that 90% of all payments will go to registered providers. But the really critical thing I think that we announced today is to move to a digital payment system. That means that everyone receiving a payment through the NDIS will have to basically declare themselves, and we'll be able to compare data between government agencies. We'll be able to trace where payments are going. So it's about building really a series of measures that together will give taxpayers and participants more confidence that the money from taxpayers is going to where it actually needs to be. The Criminal Intelligence Commission evidence, though, to the NDIS integrity inquiry that I talked about is pretty sobering. It's not just some sort of fly-by-nighters that are making a bit of money out of the NDIS, and they have been attracted to this honeypot as well. And it is, as the involvement of the Intelligence Commission indicates, requiring a whole range of resources across government to combat.
Next question, James Mager from Bloomberg.
Thank you, Minister. A lot of governments around the world are struggling to balance social welfare spending, defence spending, and all the other things that governments think they need to spend money on. And you've spoken about the NDIS as being something the Labor Party and the government is very proud of, also a model for other countries. When you speak to other countries or when you talk about this, what are the lessons that people should draw about what they should not do? You spoke about a number of design flaws in the scheme itself. So looking back over the 10 years or so that it's been in place, what are the things that were mistakes that other places could learn from what Australia did wrong?
Well, this is a unique scheme, so it's not really something necessarily that we compare to other countries, because there aren't many systems like this. This is a unique scheme in the sense that it covers people every day, usually for their entire lives, people with lifelong disability. Very different to the episodic support that people might get from the healthcare system, very different to aged care, where people will get that same level of intensive support, but for a relatively short period of time at the end of their lives. And so the philosophical underpinnings for a lifelong scheme of support are necessarily different. They involve much more choice, much more control, much more individualisation of support needs than you'd see in other health and social care systems. And I think that was the right philosophy that the designers of this scheme had in mind 10 or 15 years ago. But it also, I think, would have benefited through its implementation through applying some of the core design features of a good social program. Eligibility, who's in? What do they get? A good service list so that we know what they're actually getting once they are in. What are the pricing regimes? So a disciplined pricing regime. And fourthly, what are the quality assurance mechanisms in place? These are the four pillars of any well-functioning social program. Yes, you have to overlay that in the NDIS with the unique philosophy of a scheme for lifelong support. But I think what I've tried to outline today is the need to get back to those basic design pillars of a well-functioning social program that's working for participants, but also is effective for taxpayers.
Jake Evans from the ABC.
Minister, thank you for your speech. You mentioned a few times during that speech your intention to return the NDIS to its original purpose, its original intent. The changes you're announcing today will reduce choice of providers, they'll reduce the abilities of what plan managers can do, they'll reduce social participation, at least in hours, if not in what people can do, but certainly that builds on those reforms of last term that also restricted the options for NDIS participants. When the NDIS was first formed, it was based on control, individualised plans, the freedom for NDIS participants to choose their own lives. Is the government accepting that it can no longer meet the original promise of the NDIS?
Well, as I said in response to the last question, choice and control has got to be at the centre of this scheme to ensure that it delivers what people with disability and their families want and need and deserve. Choice and control has got to be that core philosophy. What I have announced today, though, is a move away from the let-it-rip market that I think has built up over the last 10 years, where there's very little oversight or line of sight about the quality and the qualifications of providers of essentially taxpayer-funded services. So in some areas, particularly in really critical areas like supported independent living, where people are getting very close personal supports that goes to the core of their well-being, we want to commission those services. So organisations have to apply and demonstrate their compliance with certain performance measures or qualifications. And then from that panel, yes, people can choose. We're not going to say to individual participants, you have to deal with this provider. There will be a panel, there will be still choice and control, but it won't be this free-for-all market that has developed over the last 10 years and is serving no one's interest.
Thank you. Trudy McIntosh from Sky News.
Minister, in the lead up to this announcement, you didn't want to rule in any ideas. You wanted this to be a big debate. You were asked at the time about co-contributions and means testing. Have the changes you've announced today mean that a future government won't need to go down that path? Are you still open to those ideas?
Means testing and co-contributions won't be a part of this plan. Going back to a bit to what I just said, there are unique elements to a scheme that supports people with lifelong disability, and the design of this scheme was always premised on universal access. So there was never any means testing in the scheme in its design or its implementation. And I still think that's the right approach to a scheme for lifelong supports philosophically. More practically as well, if you think about how means testing would work for people who need lifelong support, who overwhelmingly have pretty limited financial means, it wouldn't deliver much anyway. So whether you think about this philosophically or practically, it doesn't really add up. It's why the Prime Minister ruled it out, and it's not a part of this plan.
Rayanne Tamer from SBS.
Rayanne Tamer, SBS News. Thanks, Minister. On the scrapping of subsidising private health cover, how will you ensure thousands of older and sometimes vulnerable Australians don't fall through the cracks, those who relied on those subsidies during especially a cost of living crisis, but also not so reliant that they required aged care system assistance?
Look, as I said in my speech, this is the decision that Howard made to pay a higher rebate for over 65s compared to the general population makes no policy sense. I mean, if you're trying to use the rebate to shift behaviour, this is the cohort that would have the least behavioural response to an additional rebate. We know that. So the number of people that we project will leave private health insurance because of this change is about 0.4%. in a market that's growing by about 2% a year. So it will have a very, very minimal impact and had no policy merit. But from our point of view, it's more about equity. Like, it's just, to me, it makes no sense from an equity point of view for government to pay a higher level of support to one household than they do on the other, where they have exactly the same income but happen to be of different ages. Now, I know this will be a hard decision for households with private health insurance over these ages, but I think at a time where the budget is constrained and where we have to find more funds for aged care, we have to do more heavy lifting in aged care because of that demand trajectory I talked about in my opening. We just have to take these hard decisions. I don't want to take them, but we have to take these hard decisions.
And it won't be means tested? You wouldn't Did you consider allowing some?
Well, I mean, the two elements of the rebate that I think, from a policy and equity point of view, that were poorly designed by Howard was, firstly, that everyone got the same. There was no means testing, and you'll remember, Tom, when we were last in government, we did introduce means testing for the rebate. It was a struggle to get it through the parliament, but we got it through the parliament. So we've done that. The second inequity, really, of Howard's model or legacy was this intergenerational inequity, and we're dealing with that in this budget.
Alan Ransley from the Courier Mail.
Thanks, Minister. What you've outlined today will require a lot of cooperation from the states, but as you've mentioned, Queensland still isn't on board with Thriving Kids. So how can you be sure that they and all the other states and territories will agree with what you've said today? And just back to the National Cabinet meeting you were talking about before, states told you and the Prime Minister that they would agree to increase their cap on contributions to 8% from 2028. What assurances have you got that they remain committed to that?
Well, they signed a deal. I've got their signature.
Didn't they sign a deal on the Thriving Kids though?
Yeah, well, I tried to make that point earlier too. Call me old-fashioned. You sign a deal, you stick to it. They signed a deal twice, back in 2023 when I conceded, Premier Christopher Foley wasn't in the chair, but earlier this year again, that their escalation rates would increase to 8%. Currently they're only paying growth of 4% or lower. So for state and territory governments, it's in their interest as well that we get this spending growth under control. There'll be a benefit to their budget as well, but I know that in their hearts they also share that interest in getting the NDIS back on track. So they've signed this deal. They signed a deal that committed to implementing Thriving Kids. We haven't yet got them to sign the bilateral deal that sets up the design of the model effectively that every other state and territory, Labor and Liberal, have signed. But I expect they'll do that because I know their community will be asking, the Queensland families will be asking, well, what's going to happen to us when these changes take effect? Where are the local supports for Queensland families going to be when every other state and territory is just getting on with it, just getting busy building those supports, and Queensland seems to be willing to sit on its hands? I just don't think that's a sustainable position for them.
So you're confident that they will get on board with these reforms?
I'm always an optimist.
Tom McElroy from The Guardian.
Thanks for taking our questions, Minister. Last year you said that participants with psychosocial disorders were the next big cohort of work. Where are you up to with that, and do they face a higher bar under the assessment tools that you've talked about today for 2028 and beyond?
Well, the second question, no. As I've tried to indicate, there's no different bar, to use your language, for particular diagnoses. This will depend upon people's functional capacity. And as we think about who we expect would likely be shifted from the scheme now onto one of these systems of community supports, it's a very small number of people with psychosocial disability. We're pretty confident the people on the scheme now with psychosocial disability have very high support needs. It's not easy for someone with mental health needs to get on to the scheme. If anything, there's probably some unmet need outside of the scheme, which has been identified in discussions between state and territory governments. Rachel Stephen-Smith is here. Health ministers have had a number of discussions about this cohort, including with mental health ministers in those jurisdictions where they exist. We only did that a couple of months ago, I think, and we're determined to have that as the next cohort. That will be part of the negotiation process that will happen next year in our mental health and suicide prevention agreements.
Dana Daniel from the Canberra Times.
Thank you, Minister, for your speech. You've mentioned the hospital funding agreement. The ACT hospital system has been under so much pressure that the Territory Labor government has imposed a health levy on ratepayers. They argue that the ACT hospital system is underfunded relative to the cost of providing care in a smaller jurisdiction. You've given the Territory a short-term boost of $150 million over 2 years, while the way that the efficient price is calculated is reviewed. Some say that while it is more expensive to deliver care here, that the ACT system needs to be more efficient. Do you agree with that criticism? Do you support a special loading being applied to smaller jurisdictions? And should the ACT be more efficient in running its health system?
particularly with Rachel here, I'm not going to tell her how to operate their hospital system. I mean, in our agreements, we try to ensure that there are certain quality indicators in those agreements. I don't intend to add to that for the ACT or any other particular jurisdiction. We did, though, as you concede, put in place some additional funding for the 3 small jurisdictions. We also substantially lifted the base funding, for example, for the NT, the Northern Territory, which was receiving the lowest level of hospital funding support of all jurisdictions, in spite of the very significant demands on that jurisdiction. So I think we've done a lot for those 3 small jurisdictions. I support the process of the Financing Authority now analysing whether there should be an ongoing loading. Want to wait, obviously, to the outcome of that, but I think that's important work.
Will there be another top-up in the budget next month?
I think I've given enough away about the budget. Katie Gallagher's giving me a look, and I think I've said all that I'm authorised to say. Anyway, we are waiting for the work of that agency, the pricing agency.
Karen Barlow from the Saturday Paper.
Minister, thank you for being here. The national gender pay gap is at a record low, and this has happened under Labor. How does it square with you that initiatives under Labor, the triple bulk billing incentive, urgent care clinics being expanded, and the loss of certain mental health item numbers have increased the gender pay gap for female GPs? Should longer consultations receive a higher rate so that women's work is more valued?
Look, Karen, I've never seen any hard data on this. It may exist, but anecdotally, I very much accept that female GPs tend to do longer consults. I've just seen enough anecdotal evidence about that to accept that as a general proposition, without necessarily seeing the hard data. They do a lot more mental health work. They do a lot more multiple condition work, particularly with female patients. And that's why we put in place what we call a Level E consult after the Strengthening Medicare Task Force very much recommended that back in 2023, so that GPs would be paid for a consult of 60 minutes or more. That was something that female GPs talked to us very much about. Domestic violence, family and domestic violence groups talked about in particular, because often victims of violence need to talk with their GP for extended periods. And we were very careful not to nickel and dime that consult. I mean, it is a relatively generous consult level, which with bulk billing incentives on top of it is working very well, as I understand it. Now, we'll continue to work with the AMA and with the College of GPs about the way in which the rebates are both tiered and recompensed. That I recognise that is ongoing work we have to do, but I make no apology for the fact that we had an affordability crisis. It was a burning platform in general practice that we had to deal with in our first term, to deal with the plummeting rates of bulk billing that was creating huge inequity in terms of access to healthcare. I do accept, though, that the broader reform work, the deeper reform work that I wish I'd been able to spend more time on in our first term instead of just dealing with that affordability crisis, is still work to do.
We've ticked over. I know you love coming here, though. Squeeze 2 or 3 more in, sure. Can we? All right. Short and sharp if we can, please. Matthew Franklin from Capital Brief.
Hey, Minister, Matthew Franklin from Capital Brief. The Australian Medical Council says that 31% of doctors working in our system are trained overseas, including 56% of GPs, and I've seen figures of nurses up to about 40%. At the same time, your political opponents are demanding an end to mass migration. I'd like to ask you 2 things. One, what would happen to the health system in this country without foreign workers? And 2, could you guarantee that whatever the Labor Party is doing on its next immigration targets or migration targets, that it won't be cutting more income of skilled workers for the health sector?
Well, again, more than one question this seems to be catching, but I'm not the immigration minister. I'm not in a position to give some sort of expression of immigration policy. But what I will say, from my portfolio perspective, is that whether it's health or aged care or disabilities, there is a huge reliance on overseas workers. In particularly the social care portfolios, people on often temporary visas, student visas, for example, partners of skilled migrants, you will find in pretty much every aged care facility and disability home that you visit. They are a very important part of our workforce at a time when we have quite low unemployment in comparable terms. In health, we've always relied on overseas trained doctors, particularly in rural communities. We're certainly working very hard to expand the number of Australian trained doctors. There are a lot of Australian trained nurses coming out of our universities. Keeping them in nursing is really the bigger challenge, but we're not training enough doctors in Australia, and that's why over the last couple of years we've been expanding medical schools for the first time really in a decade. But to take up your sort of full toss on leg stump, very much our health, aged care and disability system rely heavily on overseas trained workers, overseas trained doctors and overseas trained nurses. I think anyone in this room has worked in those sectors know that they're an incredibly important backbone of our health workforce.
Thanks. Zach De Silva from AAP.
Hi, Minister. Thank you for your speech. On the development of extra foundational supports that you've flagged, are there certain kinds of support that you're preparing to work on first? And do the states have a point when they say this really just shifts the cost to taxpayers from the NDIS budget to other areas of the budget?
Well, the first point to make is the NDIS was set up to support people with significant and permanent disability. So to the extent it is expanded to support other people, that was never the deal. That was never the original intent. It was never what all state, territory and Commonwealth governments signed on to 10 or 15 years ago. So we've got to reset it back to that. The other point we've made, though, this goes back to the 2023 National Cabinet Agreement, is we understand that is a shared responsibility, that where people will need those local community supports rebuilt, then we should share the funding of that. 50-50 between the Commonwealth and the group of state and territory governments. We remain committed to that. Last year, I confirmed that we were extending that funding in the long term, not just for 5 years. So we remain committed to that. What they look like will really depend on the cohort. They're obviously going to look very different for kids under 9 compared to middle-aged adults with severe and chronic mental illness. But for that cohort, for example, we don't have to get a blank sheet of paper out. Like before the NDIS, those supports were there. They were operating really well, providing curated, congregate settings in which people with severe psychosocial disability could come. Programs like personal helpers and mentors, day-to-day living, organisations that have been delivering those services for many years. The problem has been that as the NDIS has taken in so much of the government funding in this space, those services have been either wound back or in some cases dismantled. And all state and territory and Commonwealth governments have a responsibility to rebuild them.
Thank you.
Nick Stewart to bring it on home with a nice, short, sharp one.
Following up that, you talked about functional care, what people need. Do you eventually see a situation that we might be moving towards where whether you're over 65 or under 65, you'll still get the same degree of care? Whether you're under 9 or over 9, you'll still get the same degree, so that effectively age will be not a worry, and the care will be dependent upon what your functional capacity is?
Well, to some degree, yes. Nick, I'm not sure what you're getting at. I think I do. To some degree, yes, we want to see the scheme, the NDIS determined upon functional capacity, but we still do have age barriers for aged care compared to NDIS. As you know, it was an original design feature of the NDIS. We have no plan to change that. So if that's what you're getting at, that age delineation will remain in place.
I think I've figured out why you're back after 8 months. Maybe your last guest speaker membership was about to expire, so we do have a new one for you. We do appreciate your time on weighty matters today, Minister. Ladies and gentlemen, please thank Mark Butler. Thanks, mate. There you go. There's a new one. Thank you.
Okay, that was the Health, Aged Care and NDIS Minister Mark Butler addressing National Press Club there. The Health Minister has announced some sweeping changes to the National Disability Insurance Scheme aimed at tightening eligibility rules to reduce the number of participants from 760,000 people today to around 600,000 people by the end of the decade. The government will also aim to reduce the total cost of social and community support from an average of $31,000 per person this year to about $26,000 within 2 years. There'll also be a crackdown on registration, expanding the categories of providers who will need to be fully registered, and an attempt to reduce spending on third parties managing NDIS plans by 30%. So to talk us through this announcement, I'm joined by our Disability Affairs reporter Naz Campanella in the studio. Hi there, Naz. So there was quite a lot to get through in that speech and those questions that the Minister answered afterwards. Take me through some of the key takeaways from this announcement.
Well, you are right. There was a lot in that speech, and so a lot to unpack. We are still working through it, but here are some of the top key takeaways. Firstly, it's the tightening of eligibility. The introduction of a standardised, what Minister Butler has called an objective tool to look at the functional capacity of people who are requesting to enter the scheme. As you said in your introduction there, Melissa, an attempt to reduce the numbers of people on the scheme. There are 760,000 currently. The trajectory by the end of the decade was 900,000, and now they are hoping to revise that to 600,000. So in a sense, going from today, 760,000, that will be now reduced to 600,000 by the end of the decade. Some of the other things, tightening of registration, so expecting more providers to actually be registered if they want to provide services to NDIS participants. Another key measure was a digital payment platform, something that many people have actually called for in the community, for that real-time check, balance and notification of money going in and out of the scheme. One of the other big measures that has been talked about widely was on July 1st, a new planning framework was meant to be introduced, so July 1st this year, and that has now been delayed until April 1st next year. That is something that the Reform Advisory Committee, a group set up to advise the government on these particular reforms, actually called for in its last meeting, and so that call has been heeded. So that will happen April next year. The other thing is around those intermediaries that you mentioned. So intermediaries refer to, for example, plan managers, people who receive the invoices from a provider, check it with the participant, and then basically pay the invoice. And obviously they are people who are paid for, so the government is wanting to look at the cost of those plan managers and make that far more efficient as well.
Yeah, as you say there, Naz, quite a lot to go through. One of the other things that stuck out to us was this community participation that the Minister touched on. Can you take us through what he said there?
Yeah, so let's be clear. Community participation or social and community participation refers to when, for example, support workers might be taking a participant to do their groceries, out into the community to attend programs, events, perhaps go to the doctor, things like that. Now, the Minister has said that 5 years ago, $4 billion was being spent on that, and in the time since, that has almost tripled to $12 billion, so a significant increase in that, and that there will need to be reductions in the spending of those services to people.
Now, in simple terms, Naz, what are these changes going to mean for states and territories? Obviously, the NDIS is this national scheme. If more people are coming off the NDIS and into state-based services, what is that going to mean, and do those state-based services exist?
So, really good question. One thing to note is that many of the state and territory-based services shut once the NDIS was rolled out in 2013 and there beyond. And so for a very long time, there's been a lot of criticism that the only place for people to go to for support when it comes to disability is the NDIS. So in a sense, it's almost like the states and territories have been put on notice again that they will need to carry some of this load of people who are already sitting outside the scheme without support and who require it, and then people who will be moving off the scheme as well.
I think we've got a little bit of the Minister's speech from a little earlier, if we can take a listen to what he had to say.
The NDIS will obviously be accounted for in the budget, but this is bigger than the budget. The NDIS is a statement of our national values. It's a measure of our national character. It's more than a source of support for people with disability, it's a source of pride. But every story about a dodgy provider rorting the system eats away at that. Every example of taxpayer money wasted on fraud erodes that trust. It's why these reforms are about much more than budget savings. This is about saving the NDIS itself. Because if we act now, we can safeguard and strengthen it so that it serves Australians it was created for, so that it upholds its purpose of providing choice and control, dignity and opportunity to Australians with a permanent and significant disability. And then we can make sure that, like Medicare, the NDIS is still changing lives 3 decades from now. But if we wait, if we hang back, if we imagine that hard choices can wait for easier times, then the decision will simply be taken out of our hands. The social licence will be lost, and the NDIS will not be able to deliver what Australians with disability deserve.
So Naz, throughout this morning, ahead of this speech, you were talking a lot about some of the anxieties among the community with this announcement to be made. How do you think the community will respond to these changes?
I think many people will feel quite gutted today. I think they will have many more questions about some of the reforms that have been announced today. I think there will be the same split that there has always been over the crackdown on registration. For many people, they say that demanding that more providers are registered will provide the extra safeguards and quality and protections that participants deserve. But then on the other side, you will have people with disability who say, well, that's going to reduce the choice and control over who looks after us, who comes into our home and does those personal care sort of items with us. You will then have many people asking questions about the reduction of spending on community and social participation. Many saying, well, isn't that the whole part of the NDIS? It's one of the biggest goals is to get people out into the community. I did a quick whip around with people just after the speech asking for their reaction, and one person pointed out, well, in the last 5 years where the spending went up, 5 years ago we were in the middle of a pandemic. Nobody was going out. So perhaps that is why there was a lack of spending there, because no one was allowed to leave their homes. I think there will also be major questions about the standardised eligibility testing. What will that look like? Who will do those tests? What will the rules around them be? What will the guidelines be for people to appeal as well? So really, Melissa, lots of unanswered questions now.
Absolutely, lots more to come on this, no doubt. Naz Campanella, thanks very much for your analysis this afternoon. Really appreciate it.
Thank you.